I'm Dr. Deepak Kapoor. I'm president of Advanced Urology Centers of New York, the largest urology group practice in the United States. And I'm also president of the Large Urology Group Practice Association, representing about a third of private practice urologists in the United States. There are two large studies that have been done on prostate cancer screening. One of them is the prostate lung colorectal ovarian study, the PLCO. The other is the European randomized study for prostate cancer screening, the ERSPC study. The USPSTF, the United States Preventative Service Task Force, which, by the way, does not have a single person on it that has ever treated a patient with prostate cancer, came to the conclusion relying on the PLCO data. Now, in the PLCO study, it showed that there wasn't a significant advantage to screening. Unfortunately, the PLCO study was a very poorly, the study was contaminated because more than half the patients in the control group, which was the non-screening group, had screening. So basically the study compared no screening against 50% screening, which is nonsense. It's ridiculous. You can't make that determination from that. The larger study, which is the ERSPC, which is more than twice as big, demonstrated that there was a significant survival advantage to men that had screened, and in patients that were followed for over 10 years, that survival advantage was even greater. The other thing that the USPSTF did was they confused treatment with screening. There's virtually no risk to screening. As we said, it's a simple blood test and a physical examination. What they said is that if you get a screening, you may then go and have a biopsy. And if you have a biopsy, you may then get a treatment that you don't need. And because you may make a choice to have a treatment that you don't need, you should never find out in the beginning and have a PSA. So what basically this is doing is it is removing the ability for a man to make his own healthcare decision. What you have is a government agency that is acting as a surrogate for a man's ability to make his own choice. The USPSTF basically said, we don't think that men in the United States are smart enough to go ahead and decide what treatment is best for them, so we don't even want them to know if they have prostate cancer. Now, one of the things that's most telling, as we talked about earlier, one of the big risk population is African Americans. The USPSTF released their draft recommendations in 2011. 2 weeks after the USPSTF told men across the United States they don't need to have PSA testing, and they didn't segregate out the family risk in African American patients, telling them also you don't need to get PSA testing. 2 weeks after they told African men don't get your PSAs done, President Barack Obama had his PSA done. So what I say is that if it's good enough for the President of the United States, then it's good enough for you and me.